Hi everyone, Erin Covert here from Studio for Mindfulness, and today I'm going to talk to you about breathing pattern disorders and how you can prevent them. So let's do a quick little survey here. Now, raise your hand if you have ever experienced any tension in your upper back, your neck, your shoulders, or even your low back with no explanation and virtually no sense of relief. Okay, good. Now, raise your hand if you've ever experienced a migraine headache or had faintness or dizziness without any known cause. Okay, good. Now, raise your hand if you've ever had a sudden onset of anxiety or had a panic attack. Good. Now, it's not going to surprise you that most people have raised their hands for one or more of these questions, but what might surprise you is the possible cause of these and other signs and symptoms, such as carpal tunnel syndrome, Raynaud's phenomena, phobias, insomnia, digestion issues. All of these could be caused from a breathing pattern disorder. So, what is a breathing pattern disorder? Sometimes called hyperventilation syndrome, sometimes called upper chest breathing. A breathing pattern disorder is a complex set of behaviors that leads to overbreathing in the absence of any pathology. So basically, you're breathing in an inappropriate way for the circumstance. This confuses your central nervous system, and that confusion sets off a whole chain of events. First thing to happen is you're going to start breathing with your upper chest. Every breath you take is going to contract your neck muscles, including your scalene muscles, the muscles that tie into your neck and wrap around to your collarbone. It's going to contract your sternocleidomastoid, which ties in up near your ear and comes down to your chest clavicle area. It's going to contract your upper traps. Even the muscles, the rhomboids between your shoulder blades are going to contract. Your quadratus lumborum in the low back. All these muscles are going to contract with every breath. Now, your body thinks it's in survival mode, so this is appropriate if you are in a survival situation. But absence of anything like that, it's inappropriate to breathe like this. So then from there, the next step is that your body is going to begin to shut down non-vital resources to sustain survival. So you're going to stop digesting properly, your sleep can be interrupted, and you might even have reproductive issues as well because your body's focused on potentially surviving. And then from there, you might become very hyper vigilant in your environment. And all these biochemical reactions, they affect every system of the body. Sustain this long enough, your body's going to start kicking out hormones to maintain this. Eventually, if there's no change in the stress response, your body will eventually respond with exhaustion. So what do we do about this? Belly breathing will help you prevent any breathing pattern disorders. Now, we know we've talked about belly breathing before, so today I'm going to dig a little bit deeper into that. So belly breathing is when you use your diaphragm muscle to inhale and exhale. So your diaphragm muscle actually sits right up in your upper belly area between your rib cage and kind of near your spine. This is what it looks like. It kind of looks like a mushroom, doesn't it? It's got the rounded top, and then we have these little things here which would look like the stem. Those are your vertebrae. And you can see from this picture here, it's kind of like up there. So when this muscle contracts, it expands and it grows and it gets bigger. So what that means is that your belly is going to expand and move forward when you contract your diaphragm. And then when it relaxes, it gets smaller. So here's what belly breathing looks like. You inhale in through your nose and you push it out your belly. You can see my tummy going up and you can see it. Now, I know a lot of folks like to suck their stomach in to try to look more slim or a little bit more trim. That's canceled. We're not doing that anymore. You're still going to look sexy as you do right now, even when you belly breathe and you expand your belly. So don't worry about that, okay? I want you to focus on inhaling in through your nose and expanding your belly. pushing out your belly. And this might take a few tries, and that's no problem. You will get it, I promise. So now the second component of the belly breathing is the exhale, when the diaphragm relaxes. And in order for it to relax, you are going to have to force the breath out. And I'm talking like really force it. I used to tell people, breathe like you're trying to blow out a candle. No, breathe like you're trying to blow out a firecracker or a stick of dynamite, okay? I'm talking like forcefully breathing. A lot of exercises have you put your tongue on the top of your top row of teeth like this. And you can do that too, and we'll do that today. And then from there, you're going to purse your lips together and then blow. And you want to blow for at least 4 to 8 seconds and blow twice as long as you've inhaled. Exhale twice as long as you've inhaled. So here's what it's going to look like. So let's try this a few times together. Inhale in through your nose, expanding your belly. Now I naturally just put my hand on my upper chest because that tells me if my upper chest is moving or not with the inhale and exhale, and that's just kind of like a checks and balances. I don't want this hand to move. You can put your other hand on your belly and make sure your bottom hand is moving. What upper chest breathing might look like is the where your shoulders lift and fall with every inhale and exhale. The more you begin to belly breathe, the less that will happen. And even as I was doing this exercise, I felt my shoulder blades fall down, fall away, and kind of relax a little bit, and you'll feel that too. I want to mention as well that if you get a little dizzy or lightheaded while this exercise is happening, don't worry. Nothing to worry about. It's just a carbon dioxide oxygen ratio rebalancing in your system. When we upper chest breathe, we do get a lot of oxygen trapped in our blood, which can cause it to be rather alkalinic. So when you belly breathe, it gets more carbon dioxide in and less and more oxygen going out. So it's just going to kind of balance out in your system. So you might get a little dizzy, lightheaded, nothing to worry about. It will subside, I promise. Practice this breathing pattern of inhaling in through your nose and expanding your belly, and then breathing out through your mouth. I want you to do this twice a day. And I want you to do the breathing repetition 20 to 30 times. So that's like 60 times a day. And the more you do this, the more your body and even your mind will begin to respond and relax. So give it a try. Let me know how it works. And congratulations, you're now a belly breather. Thanks, guys.